Hey, this is Dr. Steve Wernicke with CellGen Regenerative Medicine. I want you to think back to a story I know you heard once upon a time. Remember our first president, George Washington, before he became involved in politics, before he got involved in the Revolutionary War, the story we heard about him was that he used to whittle people wooden dentures. And back then, it was just a normal, natural part of the process for people's teeth to turn yellow and then green and brown and then rot and fall out of your mouth. And we only had just a few teeth left. You go see George, he'd yank those teeth out, I have to imagine, whittle you a set of wooden dentures, and you get back to being able to chew your food. And everybody said things like, you know what, getting old sucks, and it's just a bear getting old, and they just thought it was a normal part of the aging process. They just thought, you know what, man, you make it to like 45 years of age, and your teeth are just not going to be there anymore. That's just the way life goes. But then, probably somewhere around about 150 years ago now, somebody had a thought, and they said, you know what, I noticed the teeth start off white, and then they turn yellow, and then green, and then brown, and then rot and fall out of the mouth. I bet if when they were white, starting to turn yellow, if we gave them like a really good scrubbing, we could scrub the funk off of them, and then we could get them to go back to white, and if they didn't turn yellow, then they wouldn't ever turn green and brown and rot and fall out of the mouth. And I noticed that some people walk around and they got still chunks of food stuck in their teeth from what they ate 2 weeks ago. And so we could take a little piece of string and run it in between the teeth and knock out that chunk of steak that's been stuck in there for so long. And we could have this one person that their whole job was to know every tiny little thing there was to know about the teeth and look for little small problems and fix them before they ever became big problems. And so the whole concept of dental hygiene was formed. And as a result, who nowadays gets dentures anymore, right? I know that they're not completely extinct, but it's way, way less than it ever was before. It's pretty rare that I ever meet anybody who has dentures in today's age. So then let me ask you the question. Did teeth turning green and brown and rotting and falling out of the mouth, did that ever have anything to do with getting old? Was that really an aging problem? Or was it really a lack of care and a lack of maintenance? So nowadays, we brush, we floss, we rinse, we straighten the teeth so we can clean in between them better. We see the dental hygienist a couple of times a year and the dentist a couple of times a year so that we can have them take a look for all these little tiny problems. And we do so much more to take care of our teeth and maintain our teeth. And as a result, we just don't really see people needing dentures very often anymore. So obviously it was really a lack of care and a lack of maintenance issue. Well, this is true in the rest of our body as well. We have so many things that we do to take care of our teeth, our skin, and our hair because that's what you can see on the outside. But there's things we need to be doing for taking care of things on the inside as well. How many times have you done anything to take care of your joints? Would you even have the first idea what to do to take care of your joints? But the truth is there are plenty of things that you can do to take care of your joints. Keep them moving, number one. The more and more we stay still, sit, and things like that, the worse our joints get. Joints need movement to be and stay healthy. And we can do things to take care of our digestive system, probiotics, and obviously clean eating, and so on. There's things that we can do for every single piece and part of our body that we're just not putting time and attention to because nobody can see inside of you and see how things look in there to see whether it looks like you've got a nasty set of organs or a really shiny white set of organs, so to speak, like we can see your shiny white teeth, and people will judge you based on whether your teeth are shiny and white or green and yellow. How does this fit into regenerative medicine? Well, unfortunately, I know a lot of times people have not done a good job of caring for their body over the years that they could have and should have. Regenerative medicine a lot of times offers us the ability to turn back the clock, to be able to regain some of the ground lost, and to be able to heal up from some of the injuries that have just been degenerating and getting worse and worse with time. And then in our particular regenerative medicine practice, we put a lot of time and a lot of attention on helping our patients to learn how to better care for themselves and how to do the right things to make it where they can maximize the response and the benefits that they can get out of regenerative medicine and be able to not just keep blaming everything on getting old and being such a victim of the aging process, but actually start making things get better with time instead of worse with time. And it's important to realize that age and time run on parallel tracks, but they're not the same things. There's nothing anybody will be able to do about how old you are tomorrow, but we can do things about whether your body's getting better with time or worse with time. So I encourage you to look to see if regenerative medicine might be an option for you that could help you to get back to being able to do things the way you used to be able to do them, feeling the way that you used to feel, and having the amount of health and vitality that you used to have. So please let us know if we can be of any help or any service to you. You're welcome to call the office, set up a time to get checked out and evaluated, and see if regenerative medicine might be an answer for you. Thanks so much for your time and attention. Feel free to post questions and comments below, and I look forward to seeing you soon. Thank you.